Heart issues encompass a wide range of conditions that affect the structure and function of the heart. The heart is a vital organ responsible for pumping oxygenated blood throughout the body, and any disruption in its normal functioning can have serious consequences. From coronary artery disease to arrhythmias, heart failure to congenital defects, these issues can significantly impact a person's health and quality of life. Recognizing and understanding these heart issues is crucial for early detection, proper management, and effective treatment. Here are top 10 heart issues. Before starting, don't forget to like and subscribe to our channel for more future updates. So let's start. Number 10. Coronary artery disease, CAD. Coronary artery disease, CAD, is a common heart issue that occurs when the coronary arteries, which supply blood and oxygen to the heart muscle, become narrowed or blocked. It is primarily caused by a buildup of cholesterol, fat, and other substances called plaques on the inner walls of the arteries. As these plaques accumulate over time, they can restrict blood flow to the heart, leading to various symptoms and complications. When the blood flow to the heart is reduced, it can result in chest pain or discomfort known as angina. This pain is typically felt in the chest but can also radiate to the arms, shoulders, neck, jaw, or back. If a plaque ruptures or a blood clot forms and completely blocks a coronary artery, it can lead to a heart attack, causing permanent damage to the heart muscle. Number 9. Heart attack. A heart attack, also known as a myocardial infarction, is a severe and potentially life-threatening heart issue. It occurs when there is a sudden blockage in one or more of the coronary arteries, which are responsible for supplying oxygen-rich blood to the heart muscle. The blockage is usually caused by the buildup of plaque, a combination of cholesterol, fat, and other substances, within the artery walls. When the blood flow to a part of the heart is significantly reduced or completely cut off, the affected heart muscle begins to suffer from a lack of oxygen and nutrients. Without prompt medical intervention, this can lead to permanent damage to the heart muscle or even death of the affected tissue. Number 8. Arrhythmia. Arrhythmia refers to abnormal heart rhythms that can occur due to various factors. The heart relies on a precise electrical system to maintain its rhythm and pump blood effectively. However, in arrhythmias, this electrical system malfunctions, causing the heart to beat too fast, tachycardia, too slow, bradycardia, or irregularly. Arrhythmias can occur in different parts of the heart and have varying levels of severity. Some arrhythmias are harmless and may not require treatment, while others can be life-threatening and require immediate medical attention. Common types of arrhythmias include atrial fibrillation, atrial flutter, ventricular tachycardia, and supraventricular tachycardia. Number 7. Heart failure. Heart failure is a chronic condition characterized by the heart's inability to effectively pump blood to meet the body's needs. It occurs when the heart becomes weakened or damaged, impairing its ability to adequately supply oxygen and nutrients to the organs and tissues. Heart failure can result from various underlying causes, such as coronary artery disease, high blood pressure, heart valve disorders, or previous heart attacks. When the heart fails to pump blood efficiently, fluid may accumulate in the lungs, causing shortness of breath and coughing. This fluid buildup can also lead to swelling in the legs, ankles, and abdomen. Other common symptoms include fatigue, weakness, and a reduced ability to engage in physical activities. Some individuals with heart failure may experience chest pain or palpitations. Number 6. Hypertension, high blood pressure. Hypertension, commonly known as high blood pressure, is a common heart issue that affects millions of people worldwide. It occurs when the force of blood against the walls of the arteries is consistently too high, which can cause damage to the blood vessels and organs over time. Hypertension is often called the silent killer because it usually has no symptoms but can cause serious health problems, including heart attack, stroke, kidney failure, and vision loss. Risk factors for hypertension include age, family history, obesity, smoking, and a sedentary lifestyle. Treatment for hypertension may include lifestyle changes such as exercise and a healthy diet, as well as medications to lower blood pressure. Number 5. Valvular heart disease. Valvular heart disease refers to conditions that affect the valves of the heart, impairing their normal functioning. The heart has 4 valves: the mitral valve, the tricuspid valve, the aortic valve, and the pulmonary valve. These valves ensure that blood flows in the correct direction through the heart chambers and prevent backflow. Valvular heart disease can manifest in different ways. Valve stenosis occurs when a valve becomes narrowed, hindering the flow of blood. This puts additional strain on the heart, as it must work harder to pump blood through the constricted valve. Valve regurgitation, on the other hand, happens when a valve fails to close tightly, causing blood to leak backward into the previous chamber. Number 4. Congenital heart defects. Congenital heart defects are structural abnormalities that are present at birth and affect the normal functioning of the heart. These defects can vary in severity and can involve different parts of the heart, including the valves, chambers, or major blood vessels. They occur during the development of the fetus, often during the first trimester of pregnancy, when the heart is forming. Congenital heart defects can manifest in various ways, such as a hole in the heart, such as atrial septal defect or ventricular septal defect, abnormal heart valves, such as mitral valve stenosis or aortic valve regurgitation, or malformation of the heart's chambers, such as hypoplastic left heart syndrome or tetralogy of Fallot. Number 3. Cardiomyopathy. Cardiomyopathy is a heart issue characterized by the disease or dysfunction of the heart muscle, known as the myocardium. This condition can cause the heart muscle to become enlarged, thickened, or rigid, leading to a decreased ability of the heart to pump blood effectively. There are various types of cardiomyopathy, including dilated cardiomyopathy, hypertrophic cardiomyopathy, restrictive cardiomyopathy, and arrhythmogenic right ventricular cardiomyopathy. In dilated cardiomyopathy, the heart chambers become enlarged and weakened, resulting in a reduced pumping ability. This can lead to symptoms such as fatigue, shortness of breath, fluid retention, and an irregular heartbeat. Number 2. Peripheral artery disease (PAD). Peripheral artery disease (PAD) is a cardiovascular condition that affects the arteries outside the heart, particularly those supplying the legs and feet. It is primarily caused by atherosclerosis, a condition characterized by the buildup of fatty deposits and plaque within the arterial walls. As the plaque accumulates, the arteries become narrow and hardened, reducing the flow of oxygen-rich blood to the lower extremities. This restricted blood flow can result in various symptoms, such as leg pain or cramping during physical activity, known as intermittent claudication. As PAD progresses, individuals may experience persistent pain, numbness, or weakness in the legs and feet, even at rest. Number 1. Stroke. A stroke is a serious heart issue that occurs when blood flow to the brain is interrupted or reduced, causing brain cells to die. Most strokes are caused by a blood clot that blocks an artery in the brain, while others are caused by a ruptured blood vessel. Stroke can lead to long-term disability or even death, making it a critical medical emergency that requires immediate treatment. Symptoms of a stroke include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion or trouble speaking, trouble seeing in one or both eyes, difficulty walking, dizziness, or loss of balance or coordination, and severe headache with no known cause. Risk factors for stroke include high blood pressure, smoking, diabetes, obesity, and a family history of stroke. This is it for today's video. What do you think of our video? Feel free to share your thoughts in the comments section below. Don't forget to like and subscribe to our channel for more future updates. Thanks for watching.